Hello, Seagulls. It is Thursday, April 29th. Thank you for joining us today. SU's weekly COVID-19 positivity rate remains well below 1%. This week's number is 0.12%, and we continue to conduct roughly 1,000 tests on most days. Last week, the University System of Maryland announced that students and employees at all USM institutions, including SU, will be required to be fully vaccinated against COVID-19 to be on campus in the fall. This is especially important as we intend to hold most classes and activities face-to-face next semester. Our guest for this week's briefing is USM Chancellor Jay Perman, who will share information about the considerations made in deciding on this requirement, as well as why the vaccine is such an important part of the system's ongoing safety efforts for every campus. Before we get to the Chancellor, however, I'm excited to share some information about some focused efforts to ensure all Maryland college and university communities have access to the vaccine. The Maryland Department of Health, in connection with the Maryland Higher Education Commission, has announced a series of university days at mass vaccination clinics throughout the state. On these days, Maryland college and university students, faculty, and staff will receive priority for registration and vaccination. Our local MassVax site is the Wacomico Youth and Civic Center, and university days are going on there right now through May 5th. There are also 7 other sites located throughout the state, including Western, Central, and Southern Maryland, which is great news for our students who are currently living outside the Eastern Shore. Instructions on how to make a University Days appointment are available on the SU COVID-19 Vaccination Information webpage, seen on your screen. And if you miss University Days, don't worry. You can make appointments on other dates as well. For those staying on the Eastern Shore this summer, the Maryland Department of Health and the Wacomico County Health Department continue to offer vaccination opportunities at the Civic Center and at the former Tuesday Morning store at the center at Salisbury. But please remember that for the 2-dose vaccines, wherever you receive your first dose will be the location for your second dose. So you will need to be available to return 3 to 4 weeks later to complete the vaccination process. If your home is outside Wacomico County, please be sure to bring your SU Gold Card. We also anticipate holding additional vaccination clinics on campus this summer. Please check your SU email in the coming weeks for more information on those clinics. Since Friday's announcement, one of the most frequent questions we've been asked has been how soon students and employees should schedule their vaccinations if they haven't received them already. The short answer is the sooner the better. However, to ensure that everyone is fully vaccinated by the return to campus in August, we have set a target date of Tuesday, July 6th for all SU community members to have received at least their first dose of the 2-dose vaccine or their only dose of the single-dose vaccine. Remember that you aren't considered fully vaccinated until 2 weeks following your final dose. It takes a while to go through all these steps, so you really should get started on their first dose by July 6th. Since SU began COVID-19 testing in August, we have administered about 90,000 tests. That's a number we couldn't have imagined last summer. And we will administer many, many more. Through the end of this semester, including finals week, students will need to continue weekly COVID-19 testing to maintain access to campus buildings and classrooms, and most employees will need to continue testing every 14 days to maintain campus access. Beginning the week of May 17th, students will only need to test every other week, so students, faculty, and staff will be on the same testing schedule. Everyone will need to receive an SU-administered COVID-19 test every 14 days to maintain campus access after May 18th. Starting that week, testing will be limited to Tuesdays and Thursdays only. As we prepare for the fall, we anticipate that many more employees will be working regularly on campus. I encourage you to schedule your summer testing dates now to better ensure that you receive the times you want. I scheduled all my tests this morning. I know many of you have questions about vaccines and testing as we move into this new phase, and we want to give you as many opportunities as possible to ask your questions. In addition to our weekly briefings, we will host a virtual COVID-19 town hall for faculty and staff at 3:30 p.m. on Tuesday, May 11th, and a virtual town hall for students and families at 5 p.m. Tuesday, May 18th. Please submit your questions in advance to stayinformed@salisbury.edu, and we will do our best to answer all of your questions. With that, I am very pleased to welcome Chancellor Perman to answer some of the questions his office has received about the COVID-19 vaccine requirement. Chancellor, thank you for joining us today.
Thank you, President Wight. Thank you for inviting me. I'm so pleased to be here with you. You know, I've been in the chancellorship for more than a year now, but our lockdown started shortly after I arrived, so I haven't gotten around much. I'm just now visiting many of the system's universities, happily Salisbury today, and again, I'm delighted to be here. Before I get into the vaccine mandate, which we issued last Friday, which of course is very important, I just want to especially address the students who might be tuning in. I want to say to you, students, how proud I am of what you Seagulls accomplished this year. Of all years, every obstacle that could have been thrown at you was 90,000 tests, et cetera, and yet you persevered, you achieved, you succeeded. To the seniors who will be graduating in just a couple weeks' time, you have my admiration, my thanks for bearing with us as we all learn together from this COVID year. I know the reason we've gotten through this crisis as well as we have, the reason we continue getting through it, is because of the solidarity, the hard work of our students, of course, our faculty, our staff, our leaders. Faculty and staff, kudos to you. You've achieved. We faced a year of challenges we've never seen before, and we rose to meet them. Thank you all for that. And here I want to mention Salisbury specifically, especially your president, Dr. Chuck Wight, because Salisbury brought a significant number of students back to campus this year. And even with that higher density rate, you kept your positivity rate very low. And that's because you laid in a strict set of health protocols. It's because the students, the faculty, the staff complied with those protocols, followed the rules. It's because you've created a community here that looks out for each other, has each other's backs. And I think you'll be an example for us this coming fall. Look, I think we've learned that with widespread vaccination and with continued public health interventions as needed, we have every right to expect that we'll have a pretty normal semester going forward. That's what we all want. And that leads me to why I issued a vaccination mandate for all students, faculty, and staff. It's because we want to get back to normal. And on a normal college campus, the risk of transmission is high. Students learn together, they study together, they socialize together, they eat together, they live together. And this is what we want. We want students to have that experience. We want our faculty and staff on campus and interacting with each other and with students face to face. We believe that vaccination is the way to achieve this. That said, we didn't undertake this mandate lightly. It was based on advice from our system presidents coming together, all 12 of them. It was based on consultation with our shared governance councils, representing students, faculty, staff. It was based on the recommendation of a COVID work group I convened this semester. It's a group that includes experts in public health, infectious disease, emergency management. It includes the experts who help run our campuses and know them the best. And Eli Modlin, I'd be remiss if I didn't acknowledge you here. You've been in the trenches with us since the beginning. You've been a great counselor and collaborator. Without question, the system's paramount concern since day one of this thing has been protecting the safety of our people, our campuses, the communities in which our campuses sit. And we've concluded that mandating a COVID vaccine is hands down the most effective strategy we have to do that, especially as we try to contribute to reaching herd immunity. You know, there are different numbers being suggested right now as to what may get us there. 70% of the population vaccinated, 80% of the population. Yeah, we really don't know, but we do know that with a high risk of transmission at a university that has thousands of people on campus and in the surrounding neighborhoods, we can't simply hope that enough of them will be vaccinated to prevent an outbreak. You've all heard the expression, hope is not a strategy. We do know that the COVID risk, and this is important, is increasingly falling on young people. Among new COVID cases in Maryland, 40% are patients under 40 years old. And these young people aren't only getting infected, they're getting sick, well documented across the country. We're seeing a lot of the UK variant in Maryland, which is more contagious and possibly more dangerous. And yes, we do know that we have highly safe, highly effective vaccines available to us. Now, I should add that, of course, we'll accommodate those who have qualifying medical or religious reasons for being exempted. I also know there's already good vaccine uptake at our universities, even without a mandate, and I'm grateful for that. But we don't believe something this important can be left to chance. And your university president, our university presidents, don't believe it either. So I'm happy to hear what you think and answer your questions. Thank you.
Thank you, Chancellor Perman. We appreciate all that you and the University System of Maryland continue to do for SU and all of our fellow USM institutions. We've followed the best available science the whole way, and it has served us well. At this time, the Chancellor and I will take any questions you may have. As always, please send them via email to stayinformed@salisbury.edu. Eli Modlin, what are people asking about today?
Thank you, Dr. Wight. I'm going to start with some questions that we've received for the Chancellor. The first question, Mr. Chancellor, does requiring a vaccination violate the terms of the emergency use authorization?
Thank you, Eli, and thank you to the questioner. It's a difficult question to answer for me because I'd be giving a legal interpretation, and I'm certainly no lawyer. But I'd like people to understand, since there's been a great deal of attention to the matter of EUAs and what does that prohibit, that this is much more nuanced than it might appear. So, yes, I would say that everyone needs to know our decision-making process around mandating vaccination has been informed by advice from experts. And of course, that includes legal counsel. I assure you we'll continue to rely on those kinds of experts as we go forward in making important decisions like this, which we believe are in the best interests of our campus communities.
Thank you, Chancellor Perman. The next question goes back to something that you mentioned in your remarks. And the question is, if we reach a certain threshold, will masks continue to be required on USM campuses?
Well, as we sit here today, I would say that we're going to need the vaccinations, and we're going to need some of those public health measures in the fall. Will it be masks? Will it be some sort of distancing? I think the closer we get to the time, the better we'll know. Look how this is evolving in a very positive way. We heard the governor yesterday tell us that at least in many conditions where we're not in a big event, we don't have to wear masks outside anymore. And we got there because of vaccination and also the fact that the positivity rate is falling in the community. Let's hope it continues to go that way. We get vaccinated, the positivity rate stays low. I'm optimistic that we're going to be able to let go of a lot of these things that we all find, yes, burdensome. But on the other hand, if we're going to be realistic, one of the reasons that vaccination is so important is that we don't know what the fall is going to bring with regard to those variants. And there is evidence that masks prevent infection with variants. So again, we're going to need to see what's going on. What happens when the weather gets colder? Right now, we're in a good spot. I'm optimistic, but we're going to have to see closer to the time what we can relax, what we can put away, and what we need to hang on to or bring back. Thank you.
Dr. Perman, the next question comes from an employee that asks, what happens if a student or faculty or staff member refuses to get the vaccine?
Well, I'm assuming that that question means that the individual doesn't qualify for an accommodation. And we are certainly going to be mindful of needs to accommodate. But then the question becomes compliance. And that is something that needs to be left to the university president and the university itself with regard to the matter of complying.
Chancellor Perman, and the last question for you this morning is, how does the mandate compare to what other college and university systems are doing around the country?
Well, I think you know, or many of you know, that the last count I saw, which was probably Tuesday or Wednesday, we've got around 100 universities, colleges mandating vaccination. And we've got a lot of company in this region, which adds to the public health. Hopkins, Morgan, American, Georgetown, George Washington. Let's see what happens in Virginia as long as we talk about region. The Attorney General there issued an opinion that colleges and universities do have a right to do this. Rutgers University, the University of Massachusetts system. This is no longer a matter of private colleges and universities. Public universities are taking the same tack that we've taken because it's important, because we think it's the right thing to do. Thank you.
Thank you, Chancellor Perman. Dr. Wight, now I have some questions that have come in for you. Dr. Perman actually mentioned the accommodation process. When will students and employees be able to apply for that exemption or accommodation?
Well, as the Chancellor mentioned, there will be a process for getting an exemption for qualifying religious or medical reasons. Right now, the system is working with the COVID advisory group and with the Office of the Attorney General and with the presidents to try to figure out exactly what that looks like. So I don't have a date for you today, but as soon as that decision is made, we will be communicating out to our SU community exactly when and how to apply for an exemption if you need to.
Thank you, Dr. Wight. The next question is similar to one that the Chancellor received as well. And the question is, if everyone is fully vaccinated, will masks and social distancing and other safety precautions continue to be required?
The short answer is probably yes. As the positivity rates fall, we'll probably be able to relax many of the restrictions for getting back to a normal or near normal semester next fall, but we're going to have to keep an eye on the health of our campus community. And so for right now, it looks like masks are going to be required, but we could back off from that and either have fewer restrictions or more restrictions. We'll just have to see how it goes.
Dr. Wight, will outdoor sports be permitted to have fans, friends, and family in the stands to watch competitions?
Yes, indeed. And in fact, we have that right now. So you can go to our athletics website, suseagulls.com, and right at the top there is a link to our spectator policy. And you'll see that depending on the sport and the stands that we have, there are a certain number of tickets available to players, families and friends, and also in some cases to Maroon and Gold Club members.
Thanks, Dr. Wight. If a student or employee received their first dose at one of the campus vaccination clinics, one of our campus vaccination clinics, how do they go about scheduling their second dose?
That's an easy question, because if you received your first dose, then you already have an appointment for your second dose at the same location where you got your first dose. If you forgot when that appointment is, call Campus Health. We can help straighten it out and let you know when your appointment is.
And Dr. Wight, last question for this morning is, why are we testing asymptomatic people that have been fully vaccinated?
Well, the vaccine is really effective, nearly 100% effective at preventing serious illness and hospitalization, but it's not 100% effective against the virus. So anybody can still catch and transmit the virus. And so it will be our policy to test everyone.
Thank you, Dr. Wight. That does it for the questions today.
Okay, Seagulls, that wraps up this week's briefing. Our next briefing will be next Thursday, May 6th. Please continue to stay safe and healthy. And thank you, Chancellor Perman, for joining us today. Bye, everybody.